I'm Dr. Ted Fields at the Hospital for Special Surgery, talking to you about how to treat gout flares in the setting of our viral crisis. First of all, as always with gout, you want to treat the flares quickly. We know that it's like a book of matches. If the whole book is lit after days, it's hard to put it out. One match that's lit is easier to put out, so start the treatment early. In general, you can use the same treatments that you usually use. We know that some people use colchicine for flares, and that should be fine in the era of COVID-19. Some people use anti-inflammatory medications such as Advil or Aleve or prescription versions of those. As far as those go, in France, they had put out a recommendation that people who have COVID-19 should use acetaminophen, Tylenol, rather than ibuprofen. However, acetaminophen is not anti-inflammatory, so that if you have a gout flare, you're probably going to need something like Advil or Aleve if that's something that you usually use. So there was nothing that was found that was particularly bad about ibuprofen in the setting of COVID-19. It's just that in general, it's a safer drug than acetaminophen if you have a choice, for example, to treat fever. So you can go ahead and use the anti-inflammatories if that's what you use. There are people who can't take them because they've got particular GI problems or kidney problems, and that's something that hopefully you've worked out with your doctor already, or you may need to speak to your doctor about it now. Now, what about prednisone? Some people use prednisone for gout flares. Some people need to use prednisone for gout flares because the other choices like Advil and colchicine don't work out for them because they can't tolerate them or they have other medical problems. If that's you, then probably prednisone will still be the right thing for you to use in the era of COVID-19. However, prednisone does make you more susceptible to infection, so we do try to be careful about prednisone. So unless you absolutely know from your physician that you don't have a choice other than prednisone, you probably should talk to your internist or rheumatologist before taking prednisone for a gout flare. However, if you start quickly, often you can get away with only taking the prednisone for a day or two, so the risk is pretty low. But it's reasonable to talk to your doctor in this era of viral concern about prednisone in this setting. So if you have a gout flare, treat early, use your colchicine if that's what you use your anti-inflammatories if that's what you've already been told to use, talk to your doctor if you need to use prednisone, and that will be the way to get rid of your gout flare as quickly as possible. Don't forget also to take your long-term gout medications such as allopurinol or febuxostat, brand name Uloric, and to stick with your diet. Thank you.